Hey Strong-Siders, do you have low back pain and are currently going to a massage therapist or a chiropractor to deal with the symptoms? If so, maybe it's time to take a look at the root cause and try to correct some daily activities so that you don't need to go see these professionals as often. So, your common postures are probably causing your low back pain, and if not, they're exasperating. So, sitting in a chair and allowing your lower back to slump into the back of it certainly creates a bit of stress. What ends up happening is you get compression on the anterior front side of your spine, compressing the discs. That same low back compression happens when we bend over without actually hinging at the hips. You see the rounding in my lower back while I'm dealing with this bucket? This could be you at the dishwasher, or it could be you tying your shoes. Or if you're just sitting down, putting on your socks, taking off shoes, you're rounding through the lower back. When sitting down, it's not as bad, but if you try to do it standing up and you're really putting a lot of round and compression in there, of course you're going to have a little bit of low back pain. Also, picking things up and off the ground, if you're rounding through the spine and picking it up, you're going to be stressing that lower back. Check how you sit at your desk or on the couch. Do you slope to one side? This is going to compress one side of the spine while you're also going in that same flexion as well. If at work you work with two monitors and you're constantly rotating to one side, you're going to create excess tension on one side of your body, which can also lead to imbalances in and around the lower back and create more discomfort. So let's say you don't sit down, but you stand in what's called anterior pelvic tilt, which arches the lower back a lot more and shoots your butt out. This actually compresses the spinous processes in your back. So it's a little bit the opposite of compressing the disc in the front, which you see here. So in this position, when your back is arched out, it's going to cause a fair bit of discomfort, but just in a slightly different way, so your fix might be different. Here I'm standing flat. As soon as I raise my heels like I'm wearing high heels, it again puts me into even more excessive lower back arching, again compressing those spinous processes. Stomach sleepers can also experience the same type of compression in the lower back as if you're standing in anterior pelvic tilt. Simply becoming more aware of your postures will help you correct them through your daily life. In the meantime, let's work on strengthening the muscles that support the lower back. Here I'm doing a single leg deadlift with purpose. When I say with purpose, it means that I am moving slow and controlled. I'm not trying to rush through it, and I am really feeling out that I am hinging at the hips and not changing the shape of my spine at all. I show a couple different hand positions so that you can find the best one for you that helps you not move your spine. If you find balancing challenging on the one leg, you can tap your toe back in a series of steps to produce the same position and then come back up in one move after floating your toe. This will help you progress to the full single leg deadlift without having to worry about catching the balance every 2 seconds. I am stabilizing my spine while activating my posterior chain in that first movement. Whereas here, I am challenging my anterior chain while still stabilizing my spine. You see that my spine isn't changing shape as my hip flexors pull my knees in. Basically doing the same type of motion, but from the opposite side. The Swiss ball can be a little bit advanced, or if you don't have a Swiss ball, we can work on mountain climbers. Be sure that the lower back is neutral, and then slowly pull one knee in, stopping before your back changes shape. When you reach back, reset, and do the opposite side. It is very important that you control the range of motion here. If you pull the knee in too far, eventually you might go through lower back flexion, like so. We don't want to rush these movements, and we don't want to be changing the shape of the back. That is paramount. So even though I said you need to stabilize your spine is meant to move. It's just meant to move a little bit more through your thoracic spine, which is the middle section of your spine, and not so much to the lower back. So here I'm doing mini cobras, where I'm keeping my stomach and the lower part of my rib cage on the ground, clenching my glutes, pushing my legs into the ground, and keeping my abs tight. If it's a little bit hard, keep your arms on the ground and it reduces the load. Make sure that you're not just moving through the neck as well, which looks like this. Keep your neck packed in and just feel like you are slowly curling your ribs off the ground until it feels like just your bottom ones are touching. If you get a pinching sensation in your lower back, you've gone too far. As always, stay strong, Strong-Siders.